Hi folks, Dr. Ed Beyer here. Today we're discussing one of the 22 ways that are in the scientific literature that our thyroid function can be depleted, or one of the 22 scientific causes of hypothyroidism. 1 out of 8 females suffers from this, and I see a lot of them. They present to me. I've been doing this for 30 years. I've been practicing functional medicine, and they come to me, and here's the typical story that I see. Dr. Beyer, I'm gaining weight, I'm losing my hair, I'm depressed, I got digestive issues, I don't feel like doing anything, I got brain fog, life is black and white, it's not colorful anymore, I'm not motivated, all these different things. And I'm sorry, I think females have a lot more to do than males, and I'm a male saying that. Females tend to be the ones that have to juggle more than one ball. And so they're very frustrated. And they're going to their endocrinologist, and they're looking at their TSH and their T4, and they're adjusting their Synthroid and levothyroxine, or they're told their ranges look good, or they're going online and they're searching, what should I do? And they're going crazy because there's 22 different ways. No one has all of them, but my typical patient has 4 or 5 of them, and I could have someone here, patient A and patient B, with identical symptoms, but patient A's causes are totally different than patient B. So proper testing is the key. But one of the causes is thyroid resistance, the inability to get T3 into the cell due to a vitamin A deficiency. Vitamin A prevents T3 from getting into the cell. Now this is tricky because the T3 and T4 and TSH can all look great, but it's not getting into the cell, and there's no way of checking for that. So we run a micronutrient test on our patients, and we look for vitamin A deficiencies. A common symptom of vitamin A deficiency is poor night vision. You know, I don't like driving at night. I can't see that well at night. That's very common. Now, what can cause a vitamin A deficiency? Poor diet. Vitamin A is a fat-soluble vitamin along with D, E, and K, and we need proper gallbladder and liver function in order to absorb it. So if someone doesn't have a gallbladder, or they have poor gallbladder function or poor liver function, that can affect vitamin A levels. And then there's a gene called, or an enzyme called BCM01, and this gene activates the inactive vitamin A over to the active vitamin A, and many folks have a mutation on the genes that are coded to make that enzyme. So they're not making that enzyme, and they're not activating their vitamin A. Proper testing is the key. So vitamin A deficiency is a cause of thyroid resistance and low thyroid function. I'm Dr. Ed Beyer. I hope that helps. Have a great day.